Hello friends, and welcome to SPT with J and Z. Now that's not to be confused with JZ, the multi-platinum recording artist from New York. I'm Zach Carson.
I'm Josh Griffith.
And we are currently students in the Doctorate of Physical Therapy program at Grand Valley State University. We're going to do a short video series, or a long video series, over the course of this program in which we kind of recap what we learned that week of PT school. So this is a little bit of an educational emphasis, also a little bit of fun, and a little bit of review and study for us also, hopefully spreading the word to other students who might be in a similar situation as us, or students that might be looking to seek this career. So, without further ado, let's talk about ourselves for a few minutes. My name is Zach Carson once again. I am not the typical PT student. I actually graduated high school and went into the military. I was in the military, the Navy more specifically, for 6 years, and it was a blast. I got to fly around in helicopters, and it looked something like this. Maybe not quite the scale that I actually flew in, but it was the MH-60 Sierra helicopter with the Navy. It was an awesome helicopter. I was a rescue swimmer. I got to fly around. I got to jump out of it. I got to hang out with a bunch of cool people, meet some cool friends that I'm still very much in contact with today. Got to travel around the world. I've been to Kuwait. I've been to Iraq. I've been to several countries in the Southeast Pacific doing humanitarian relief. And I've seen a lot of things that are very eye-opening, and I tell you, we've got it pretty good over here. So don't ever think that, you don't have it pretty good. So after the Navy, I got out, I came back home to West Michigan here at Grand Valley, and I finished up my degree in exercise science. It was awesome. Got to meet some people there. I got to network. I got to meet the faculty, do some research, get in the labs, kind of learn a little bit about myself, what kind of things that I am capable of doing. And also I'm a huge strength and conditioning nerd, so on that route I went ahead and I got my certified strength and conditioning specialist through the National Strength and Conditioning Association. So that's kind of what I'm doing these days. I'm also a strength coach on the side. I get to teach high school athletes, middle school athletes, adult population. Heck, this past year I even got to train with a professional basketball player in Europe, and he was awesome. So a lot of fun there, getting to learn the different people and the way they move, and which ultimately leads me to the reason why I'm here in physical therapy school, because I want to learn about how people move. I want to learn about how to fix the way that they move, if they have any kind of, if they need any kind of correctional posture or anything along those lines. Also, the preventative measures that physical therapists can instill in people to make sure that they're making correct choices with physical activity and diet and exercise over their lifespan. So just moving better in general is kind of a big piece of why I'm here. What else about myself? Here's the non-typical thing about me also. This is actually my second go-around at PT school. I was accepted into the cohort at Wayne State University last fall. Long story short, this is my home. I'm married. My wife is here. She's got a great job. We did the commute game for a whole semester. Wasn't really our bread and butter. It was, we were good, but we wanted to be better. So I reapplied to Grand Valley, got in, moved back home, and I'm finding myself here now. I get to meet cool dudes like Josh, who I actually met in my undergrad degree, and get to do the whole first semester over again, so that's awesome. But at the same time, it's good because I get to bring a unique perspective to the class that might be a little bit different, and maybe even a little bit more comforting for some of the people that I get to work with. So that is me in a nutshell. Josh, what you got for us?
All right, like I said at the beginning, I'm Josh Griffith. I'm from Kansas City, Missouri originally. Went to high school, grew up in Missouri, went to a junior college out in Kansas to play baseball. So I went there for 2 years, and then transferred up here to Grand Valley to continue my baseball career. I started in the exercise science program my junior year, so I had a little bit of catching up to do as far as graduation. So after my 2 years of playing, I still had one more year of undergrad work, and finished up last year, and came to Grand Valley because of the family feel here. Loved the athletic department as a whole. Felt really comfortable with the coaches. Had a great experience playing ball here, and then also the faculty's always been like family, as far as they come in are willing to spend time with you outside of their own hours that they have to be here, and are always willing to lend a helping hand. So that left a good impression on me. Then with physical therapy school, I knew this was a good place for me being here in Grand Rapids. It feels like it's a very Midwestern feel, obviously. So that was good for me coming to a place like this. And I've been really excited to start the program here. With having clinicals mixed in throughout the curriculum, that was the deciding factor, I think, for me. So I've really enjoyed my undergrad program because it meshed my talents and my passions. Working with people is one of the things I've wanted to do all my life, and to be able to use my athletic adventures along the lines with the science has been really fun, and I think that's really going to help me out in the future. That's where my passion lies, is with strength conditioning as well. I've done an internship with the West Michigan Whitecaps, the low A ball club for the Detroit Tigers organization. I've gotten to increase my interpersonal skills in that setting as well, and hopefully it translates in the future to a physical therapy setting as well. So really excited for this year and for these next 3 years, and working with Zach and other great students at Grand Valley and the faculty as well.
One thing I did forget to mention is that Josh and I are both huge sports nuts. Myself, I love the University of Michigan. I love their football program. I love their basketball program. And I love the Detroit Tigers. And I know Josh, obviously playing baseball his whole life, he's a huge Kansas City fan. And actually last night, I started Kareem Hunt, and he went off against the New England Patriots as a rookie for his Kansas City Chiefs. And man, I'm looking pretty good for my fantasy football team this week. So on top of that, we're going to sprinkle a little bit of just kind of ourselves into this on top of the breakdown of the program. And I just did a quick search on baseballreference.com. I actually found Josh is on here. He bats right, he throws right, he's 6'3", 200 pounds. He was born May 3rd, 1993. This is all public knowledge, folks. Schools, Fort Scott Community College, Grand Valley State University. However, he has yet to log any professional stats. So maybe the dream still lives, maybe not. Maybe it'll be on a different level with a professional sports team. As he said, West Michigan Whitecaps. He's kind of gotten his foot in the door with that, and maybe in the future he'll look into the sports world for his physical therapy practice. So, going forward, let's get into the weekly breakdown of this first week of Grand Valley. So this week was a little bit different than usual because of that whole Labor Day recess thrown into it. So essentially we had like kind of a week, and then we had 2 days off for Labor Day, and then we had 2 days on for our second week. So this is actually the end of our second week of school, in which we've completed a week and a half, I guess. I'm not exactly sure how to say it, but it was still pretty good. We got some good information. We got to meet our professors and some of our classmates, and did the whole round robin introduction, get to meet and greet type thing. So with that being said, let me go to the course breakdown of this first semester. So this is the fall of 17 for the GVSU DPT program. We've got BMS 561, which is prosected regional anatomy. We have PT 517, which is kinesiology and biomechanics 1. We have PT 511, which is the foundations of physical therapy examination. PT 512, which is the introduction to evidence-based practice. We have PT 513, which is clinical science 1, and PT 515, which is a professional topics class. So let's go ahead and dive right into BMS 561, which is the prosected regional anatomy course, and Josh is going to cover some points from that.
All right, so into the PT stuff now. So in our first day of lecture, we really went over the vertebral column for the most part. So we talked about the cervical, spine, thoracic, and lumbar, and the special characteristics that each level has there. We also went over the ligaments through that region, which is something I haven't had in undergrad, and I don't think most people have in our undergrad program. So that's where the graduate aspect comes into. We're getting really down deep, learning all the structures within. So we had our first day of cadaver lab as well, getting to work with the bodies for the first time, working in the bones. Day 2, so this was Wednesday of last week, we got into the back musculature. So another thing about PT school, we're going 100%, 100 miles an hour all the time. So we went from And vertebral column, we went into the back musculature there, talking about the iliopsoas, spinalis, those typical ones that we talk about in undergrad as well. But we got into some nerves that we really don't get into a whole lot in undergrad, and the spaces in that region too. So that was I think the coolest part so far is getting to know the nitty gritty on everything. And then we got into the lab and went right into the cadavers for day 2 as well. What's unique is that we're learning in the regions this time. I know for us here, we went all skeletal system, all musculature system, and then you had your veins, arteries, all your duct work. That was all separate units. Now we're getting everything within each unit in a region. I like that because I think you can see how everything interconnects. Day 3, so just this past Wednesday, we got into the forelimb skeleton. So our upper limbs are humerus, radius, ulna, hands, a little bit of scap work as well. So in our labs, we've been going pretty much along with lecture. We've gotten a little bit behind in lecture just because there's so much of the conceptual aspect that we have to learn as well. So we're a little bit more farther ahead in the lab. So we've just been getting in each day and reviewing as much as possible there. So that's where we're at with our prosected regional anatomy right now. And Zach's going to take us to PT 517.
So in PT 517, again, that's kinesiology and biomechanics 1. The first thing we got to learn about is osteokinematics versus arthrokinematics. So if you're not familiar with those things, the osteokinematics is how the bone moves. For example, like angular motion, the bone moving around an axis, whereas arthrokinematics is how the joint space moves, whereas the bones are rubbing against each other in that joint space. So a couple things to cover from that. We're simply learning about rolls and glides and how they might go in the same direction or opposite direction of each other. Also that little bit of slide that's created in that articular space. So that was kind of the breakdown that we got there, just learning about those two principles, learning about different motions, angular motion versus linear motion, and then some of the basic planes of movement that we learned in the undergrad, just kind of recovering those and hitting those, being the sagittal plane, the frontal plane, and then the transverse plane, and things that we're going to be moving in. And most of the body moves in 3 dimensions at almost all times, so we covered some other things as far as the joints, the different kind of joints, some of their properties, and how they work and where they are and why they kind of exist in the space that they exist, like our shoulder and our hips being the ball and sockets that they are. Why do they exist, and how do they work around our torso? Some of the other things that we covered, muscle properties, so the basic breakdown of muscle properties, cross-sectional area, the physiology, how motor neurons hit those muscles and how they fire and how they're recruited. So again, all kind of review from the undergrad stuff. Nothing over the top there yet. I'm sure we'll get a little bit more intense in that as we go forward. Also, we got a chance to cover palpation and lab, very, very slightly and kind of slowly working into palpation. And for those of you out there that don't know what palpation is, it's basically just being able to touch another person and kind of getting a sense of their quality of skin, the quality of the muscle, getting down into those structures, and kind of using your hands to identify anything that might be right or wrong with those structures. So we got a brief introduction into that, and that's kind of the bread and butter. That's kind of what PT students get excited about, is actually getting their hands on other people, having them move in different directions, identifying structures, identifying where muscles attach, making those muscles contract and relax, and kind of learning how to essentially assess an injury. And that's kind of, like I said, the bread and butter of PT. So we got a brief introduction to that. We're looking forward to what comes next, and I think it's going to follow right along that track that the anatomy's on. So we're going to jump right into the spine, and hopefully next week we'll be working down the spine and getting to see the difference between the cervical column and the thoracic spine and the lumbar spine, and kind of how they differ in their structures. So on to PT 515.
All right, so PT 515 is our professional topics 1 class. So this is kind of where we're learning some skills or behind the scenes of what PTs do every day. You know, we think of PT as we're manipulating the body, we're we're learning about the musculature, the bones, but this is the part that people don't think about when they get into PT school, is where we're learning about what the profession is. So first couple of days we had our intros with getting to know everybody, get to know the professor, and then we dove right into some of the ethical aspects of being a PT. One of our first assignments is to watch a movie called Wit, and it's about a cancer patient that's going through ovarian cancer treatments, having chemo, and it really gives you a look at how some people in our medical industry may not be, as ethical as we would like. She was treated poorly by resident clinicians and even some of the nurses. So it was kind of eye-opening that is out there, and it makes you take a step back and say, hey, I don't want to be like this when I'm a clinician. Like, you gotta be a personable person. You want to take time for the patient when they're feeling down from treatments. You got to be there as a person, as a friend to some of these patients too, because they need that whenever they're going through some tough times. Our last day in this class, which was yesterday, we talked about the history of PT. So something I didn't know was that our origins come from World War II. And Mary McMillan was the first to write text on therapeutic exercise and massage. So it was more of a female-based profession at the beginning, and it's kind of reflective even in our program. We have 16 guys and 44 girls in our program. So even now, there's still more females within our profession, I would say, overall. It's still growing. Males are getting more into it, but that was a little eye-opening for me. I didn't really think of it. It's just I knew that was my passion, was to be a PT, and I just thought there were more guys out there like that. But it's pretty cool to learn about that aspect from our beginnings. So on to our Foundations in PT exam.
All right, so Foundations of PT exam it's a pretty cool class. It's actually a lot more than the title leads it on to be. There is a lab component in this one also, and then obviously a lecture portion. I'm just going to dive right into the lab component because most of the lecture portion is kind of short and kind of leads us into lab as far as what we cover. So the first thing that we covered were anthropometrics, kind of doing the girth measurements. We also talked about body types, whether a person might be endomorphic, ectomorphic, or of course Josh and I, we're mesomorphic. We're big, big and strong, or we try to be sometimes when we go to the gym. Josh leans on the little bit smaller side, as you can see, but he's working on it. He really is.
Always room to grow.
So with that, we got girth measurements. We talked about different landmarks on the body and how you can measure around the shoulders, around the chest, how you can measure around the waist, the midsection, and then obviously through the gluteal region, and then from the knee joint line up the leg and down the leg, so that way you can get the quadriceps and then the lower leg as well. So we got into that. That was a lot of fun, getting to do those measurements. Actually getting our hands on people, again, is kind of the best part about this program. The next lab that we jumped into was a vital signs lab. So this was a lot of review from our undergrad, especially myself. When I was clinical based, we got to do a lot of blood pressures, and we got to do a lot of heart rates, and we got to do a lot of respiratory rates. And we talked a little bit about, what's considered another vital sign might be pain, where it comes from, what people, how people respond to it, and how it's kind of, how it's used as a tool in the clinic when treating patients. So we got a brief introduction to that as well. So the pulse rates that we talked about, we measured it from a bunch of different spots in the body. We went from the temporal region to the carotid region, down to the brachial region here where we do our blood pressures, the radial portion, which is the common place to take somebody's pulse. We also jumped down the body into the femoral region, all the way down the leg into the posterior tibial region, and then the dorsal pedis, which is usually the toughest to feel or to get any kind of gauge on, just because the blood is so far away from the heart and it's just such a light pulse down at that region. So that was a lot of fun. And then the next lab that we jumped into was the posture lab, which was really cool because I'd never done posture before. You ever done posture?
No.
We actually got to line people up on the plumb line, put them anterior, posterior, side facing, sitting, all these different postures where we got to kind of look at people and see how their body looks compared to the normal person, which obviously if you're any kind of movement specialist, you know that every body is different in the way it looks and the way it moves and the way that it kind of fits together. So we got to talk about some different things that that happen on the normal population, how some people get that forward rolled shoulder, or they have kind of a bow-legged stance or kind of a knock-knee stance. And it was cool, actually, in our class we had a couple of people who had different degrees of scoliosis, so we got to see how the hip level was different and how their spine kind of tracked along from the neck down to the low back. And it was pretty cool because you kind of see how the body is a kinetic chain, in a sense of, hey, this person has scoliosis, their hips are here, all of a sudden now you can see that their shoulder is rolled forward, their scapula is kind of anteriorly tilted, and it kind of throws them into a whole different posture that may or may not lead to implications in the future as far as maybe different mechanical issues or muscular issues. Some people react to it differently than others, so it's just kind of dependent on the person and the kind of treatment that they've gotten over their life. So that was a really cool lab to get into and actually see those differences on people, because I know, I mean, Josh and I, we've spent a lot of time around different players, different gyms, just seeing different people move, and you can pick out the people who know what they're doing and don't know what they're doing, and then you can see the differences in how their foot strikes the ground and how their leg falls off the inside of their foot, or how they pronate or supinate, maybe how their knees drive forward and in with that valgus stress, or you know, just the different things that you want to be like, hey, that's wrong. But then again, you don't want to be that guy that's like trying to be the boss and pointing people in a direction, because we're not exactly licensed PTs yet. Although I do have a certification in strength and conditioning, so I have a little bit of ground to stand on when I'm trying to correct people. But I never want to be that guy that oversteps the bounds, and it's most important to approach people as a person first, and then you know, assess them based on their body second. So that's kind of cool. We've talked a little bit about that also in the Foundations of Physical Therapy exam. So looking forward to more labs like that, and it's just kind of a lot of fun so far.
Yeah, I'll jump off of that with that class still. I think one of the coolest things that we've been getting to do is building our skills, because you can see now we've been in lecture classes all our lives through the education, you know, growing up, high school, college, lecture all the time. Don't get to apply what you're learning.
No doubt.
So now building those skills, using a tape measure, not as easy as it looks, trying to get it around somebody. So getting to build those skills, I think, is rewarding and something that we're going to continue to practice for the rest of our lives. So it's neat to be able to do that. So I'll go right into 512.
I was gonna note real quick, especially we have this one guy in our class who's like a physique model, and he's got shoulders that are like this big, and just to measure his shoulders, I got short arms, man. How are you gonna get around that? So figuring out ways to actually like assess that problem, because you know, we're gonna have patients that are bigger and we're gonna have patients that are smaller, and being able to work around them without being like, wow, you're really big. I mean, that's kind of a no-no in the physical therapy world. So being able to figure out how to use our devices is kind of an eye-opening thing too.
Very nice. All right, so 512 is our intro to evidence-based practice in PT. Now, we haven't really gotten off to a real quick start in this one, but one of our assignments that we had was a reading on some needs that we have in the PT industry. Everybody that comes to PT school, I think, is wanting to be in a clinic for the most part, getting to work with clients day in and day out. But one of the things that we need are, you know, clinical PTs to get out and do some research too, because we need new techniques, better techniques. We have great ones now, but we've also said that in the past too. We've had great, but we can do better. So we're in a need for PTs to want to do some research as well, even though, you know, it kind of prolongs your education process sometimes a couple more years before you really get out in the clinic. But it's really rewarding for our profession to continue to grow, and I think that's something that I've even taken into consideration now that I didn't, because you don't really think about the research aspect when you're really wanting to get into PT. That's just my experience. So.
Working off of that too, like being a clinical scientist or vice versa, what Josh is talking about here, it doesn't always require that you have to go and actually get like a PhD or something that requires research. Really what what we're being taught, and it's important for everybody in every field really, is just go out and make sure you read the research. If you're not going to conduct the research, at least consume it and kind of get an idea of what's changing in the world as far as how the body works and how these different measures of PT work, and be a consumer of the product and never let yourself get stagnant. And that's why it's so important to go out and do these different professional measures as far as different conferences and getting to meet new people and get refreshing aspects of everything that you do, just so that you can continue to build your own knowledge base and implement those when you're actually doing your own practice. And I think that's an important thing that I learned early when I was in the military, also important when I've been working in the strength coaching world for the last 2 years or so. There's just so many things out there that you have to kind of learn, put them all in a big box, and then kind of reorient and retool your toolbox to your own specific techniques. And that's just, the more you know, the more you know.
Yeah. Always learning. I think that's key. We have our continuing education requirements, but you have to be active in it. You can't just be, I'm just getting these to get my hours in. I thought it was a cool thing. Yesterday we had a guest speaker that was in on our lunch hour. That wasn't a requirement, but the place was filled up. We had first years and second years all in there together, just getting some new info, and he even extended the offer to us to come to his continuing ed classes for free, which is a cool opportunity.
And he blew our mind with what he had. So Andy demonstrated it and it worked, and we were like, wow, okay, well, this guy's serious.
Yes, I got to be a tester on muscle strength, so that's pretty cool.
Yeah, I was a bold volunteer. I went up there. I pretty much volunteer for everything. The Navy actually has an acronym, never volunteer yourself again. I just went the opposite direction. I just volunteer for everything because I want to get my hands on things and I want to get to know how it all works.
Good way to look at it.
Yeah. So let's roll right into our last topic, which is 513, which is clinical science 1. This one is more or less a pathology class. So we're going to be talking about just kind of some different things about pathology to build off of our anatomy, to build off of physiology, to build off the kinesiology, and then kind of how it all ties together within our bodies. So some of the things that we talked about thus far are health and pathology concepts. We talked a little bit about behavioral, social, and environmental factors. We went into those a little bit deeper, but we also covered some differential diagnosis topics in which we talked about how the physical therapy kind of conducts the process when they have a new client or a new patient. Talked about examinations, what that means, the evaluation, the intervention, the reevaluation, and how it's kind of an ever-flowing model. And essentially the APTA has this model that has like health condition, activities, so what the person actually does. You kind of have to gather all this information during the examination process, and then all these arrows kind of go around and around and around and kind of plug back into each other, talking about how the evaluation of a client is always changing, and you should always implement those strategies into the examination. We haven't really dived too deeply into the pathophysiology portion of that yet, but we did talk a little bit about the ICF, which is the internal classification and functioning disability and health, and how that's kind of going to be our driving home model that we get to use. So it kind of shifts the focus to the life of the person and like the abilities of the person, and it talks about more than just what you see, and it talks about the environmental and personal factors, and that kind of goes back to what I mentioned with behavioral, social, and environmental, how all those things can create the person. It's not simply just the structure that you see in front of you, it's everything that goes on in that person's life, what their living status is, what their socioeconomic status is, a lot of this has to do with what we call race, or what their culture is, the different things of that, and how they all combine to that person, and how they can all lead to different things in physical therapy that we're possibly going to be treating. And we have to be the all-encompassing therapist and kind of learn all those things about the person instead of just treating the person for their diagnosis that they come in with. We have to treat them as the person that they are. Going back to just kind of the overlaying theme of physical therapy school is that every person is an individual. But we're also going to learn some pathology in that too. So I'm sure that'll get real fun real quick. You have anything to add to that?
No, I think that's the one thing that maybe not the most interesting for PTs is learning about the patho on it. But now that PTs are, we can have direct access, we need to be able to be knowledgeable in these areas and to be the most well-rounded PT we can be. So that's all I have for that.
All right. Well, that is the end of all the classes that we have this semester. Again, we will be doing this every week, kind of a breakdown of the week, and eventually we'll kind of go into a preview of the week to come once we kind of get our feet under ourselves and we can kind of pull ourselves up out of the water and start to tread a little bit above it.
Get a little schedule going.
Yeah.
Get in the routine.
It's getting busy, and we're both working a few hours every week. So we have that to deal with. I'm married, I got some other things going on. I own a house, so I got to mow the grass every dang week, and it's not a small lawn. So there's a lot of other things going on in both of our lives that we have to kind of to balance with this intense physical therapy program, but we're both excited, I know that for sure, about going forward. We're both excited about learning, and we're both excited about just getting our hands into this program. So that is all we have for today. Really appreciate you watching. Hopefully you guys will continue to watch going forward if anybody is watching. But yeah, again, I'm Zach and this is Josh.
Thank you guys. Really appreciate it. Look forward to working with you guys in the future.
All right. Have a nice day.